We begin this half hour with the global health emergency and the fight against COVID-19. Thank you for staying with us. I'm Glenda Lewis.
And I'm Brian Abel. The World Health Organization saying the pandemic is still an emergency phase, but it is in a transition point.
So for more information on this, we're going to our chief health editor, Dr. Partha Nandi, and Dr. Nandi, the director general of WHO, saying that we're in far better situation now than we were, but still considered a global health threat.
I know, a lot of people are wondering why we're even talking about this, right? Even my patients who have moved on from the pandemic and don't even think about the coronavirus. But the World Health Organization Emergency Committee does not agree with that perception. They recently met to review the current situation and declared this, that the COVID-19, the PHEIC, which stands for Public Health Emergency of International Concern, should continue, and here's why. Right, at least 170,000 people worldwide have died in connection with the coronavirus. That's just in the last 8 weeks. That's unbelievable, right? Unfortunately, there are still areas worldwide where the death rate is rising due to the virus. Plus, COVID is not going to go away. It's considered an established pathogen, and this particular virus has a very unpredictable future. So a public health emergency declared by the World Health Organization means that countries will abide by the recommendations, and the current ones are the following. Continue vaccinating citizens, especially high priority groups. Also improve reporting of SARS-CoV-2 or SARS-CoV-2 surveillance to the World Health Organization. Maintain a strong national response capacity and prepare for future events to avoid a panic neglect cycle, as they call it. Continue to fight misinformation, that's huge. Continue to support research and adjust any remaining international travel measures based on risk assessment. That's a lot.
So you mentioned death rate. Those numbers have decreased. Omicron vaccine and all vaccines. So where are we now?
So I think that's true, right? Not as many people, Glenda, are dying as we've seen with previous variants. Even the World Health Organization's Emergency Committee found that there's been what they call a decoupling between infection and severe disease, meaning infection is not always leading to severe disease. That's important. However, that does not mean we shouldn't plan for the future and also try to mitigate, right? Try to change the current virus's impact on morbidity and mortality. Here in the U.S., we have over 33,000 Americans hospitalized and a daily average of 500 plus people dying every day. To me, it's super important for everyone not to underestimate COVID, right? People need to change their perception that COVID isn't as much of a risk. It's still killing people. So once again, I keep talking about this, get vaccinated, get boosted. You talked about this, Glenda. Recent data tells us that the vaccines are indeed working and decreasing hospitalization rate and death rates. So hopefully this time next year, we'll be in an even better place with lower hospitalization rates, and that's worldwide, right? This is not just the U.S., but worldwide.
It's time.
It is. But I think if we do our thing and not go on social media and pretend like it doesn't exist and debunk everything, I think it'll be helpful. I think we just have to be part of the plan and go for it.
All right. Thanks, Dr. Nandi.
My pleasure.
Appreciate it. And if you have a health question for the good doctor, you can email him at drnandi@askdrnandi.com or send it to us on Facebook or Twitter.